The World Health Organization, WHO, has warned of 9 serious viruses that pose a threat to humanity and could lead to global epidemics, including the emerging coronavirus and the X virus. WHO presidents compiled a list of 9 diseases, of which Covid-19 was included, and classified as a priority disease for scientists to prepare human defenses. Experts describe diseases as those that pose the greatest risk to public health, either because of the possibility of epidemics or due to a lack of countermeasures against them, according to the British Daily Star. Coronavirus is currently the #1 enemy of all as it continues to invade the world, killing nearly 3 million people so far and infecting more than 150 million, but other diseases on the list are also deadly and can pose a threat unless preventive measures are taken, some of which cause encephalitis, bleeding eyes, deafness or congenital defects in the head. Black Death, and scientists fear that the next epidemic will be worse than the Black Death of the plague that killed 75 million people, and there may be health crises every 5 years, after animal-borne viruses were warned. Dr. Melanie Saville, Director of Vaccine Research and Development at CEPI, also warned that the world needs to prepare for the next big vaccine. Disease X has included Global Health X on the alert list, which could be a serious international epidemic caused by a currently unknown pathogen that causes human disease, and scientists estimate that of the world's 1.67 million unknown viruses, up to 827,000 can infect humans from animals. It is feared that as humans grow and encroach on wildlife, the risk of transmission to humans increases, with environmental writer John Vidal, looking at the links between nature and disease, predicting that we are facing a new epidemic the size of Black Death. He said a virus can spread to the ground, inadvertently spreading through asymptomatic vectors, within a few weeks, killing tens of millions of people before the border is closed. Nipah virus is 75 times more deadly than corona, and among other diseases listed by Global Health is Nipah virus, and is classified as one of the biggest potential threats to become a new epidemic if the virus mutates, 75 times more deadly than Covid-19. The virus, transmitted by fruit bats with a mortality rate of 40 to 75%, causes brain swelling, seizures and vomiting, discovered in Malaysia in 1998. Zika virus is also on the list, which spread across the Americas in 2015 and 2016, and its symptoms include rashes, fever, headaches, and muscle pain, but is rarely fatal in its current form. However, its effect on pregnant women leads to the birth of children with shrinking heads or other birth defects in some cases. The Ebola virus re-emerged in 2021, with 6 African countries on alert and the White House warning of potentially catastrophic consequences for the new outbreak. The mortality rate of this insect can reach 90% depending on stress, as patients suffer bleeding from the eye, ears, nose, and mouth, along with fever, headaches, and muscle pain. SARS also enters the list of Middle East respiratory syndrome, and SARS poses a threat to a possible epidemic, and SARS, such as Covid-19, is believed to have emerged from bats in China, and MERS from bats to camels to humans in the Middle East. Congo hemorrhagic fever and Rift Valley fever include other diseases on the WHO alert list: Rift Valley fever, Lassa fever, and Congo hemorrhagic fever.